Now, we know that millions of people are grateful for many things during this time of year. Now, if you happen to suffer from a serious illness, though, no doubt you're especially grateful for your caregiver. However, those who suffer from chronic pain every day, especially during the holiday season, it can be a challenge, including for the caregiver. Cynthia Toussaint, a former ballerina and actress who has suffered with chronic pain disorder for more than 30 years, joins us with her partner and caregiver, John Garrett, today. Thank you for joining us.
Thank you for having us, Makeba.
It's our pleasure.
Now, Cynthia, you had this great role in Spain when you were hit with a complex regional pain syndrome. What has it been like dealing with chronic pain for more than 30 years?
Well, wow, it's turned my life upside down and inside out. The nickname for my disease, CRPS, is the suicide disease, and as such, the pain actually feels as though my body has been doused with gasoline and lit on fire. And for the first 13 and a half years of my illness, because my doctors told me that my physical problems were all in my head, that left me bedridden for a decade and unable to speak for 5 of those years, while the CRPS spread throughout my body and ravaged my vocal cords. So after I finally got my diagnosis, I quickly discovered that opioids were an excellent and effective way to maintain and make my pain better, manage my pain. But I have the serious side effect known as opioid-induced constipation, or OIC. And I also have this wonderful guy that you mentioned next to me, my partner John, my husband, caregiver, and it's been John and me together going through the chronic pain symptoms for 32 years. And I wouldn't be here if not for this wonderful man. And in fact, after I realized with my OIC that laxatives and natural remedies did not work, that John actually encouraged me to go start a conversation about OIC with my doctor, and that eventually led to relief. So thank you, John.
Anytime. I'm here.
Thank you for that question, Makeba.
Now, what are some of the daily struggles that you face having OIC, and how does it impact your life?
Well, when I'm at a really high level of pain, and I'm talking about a 9 or a 10 on a pain scale from 0, meaning no pain, to 10, meaning the worst pain you can imagine, I have to always weigh the very difficult decision of getting relief with opioids, but also dealing with the OIC, or not getting any relief. And when I choose the opioids, my pain generally lowers to about a 3 or 4, which allows me to get a good night's sleep and wake up with my pain reset, and I'm ready to take on a new day. However, then I generally have to deal with the OIC, and the straining has been so severe that in the past that I've actually developed a hiatal hernia as a result, and also that straining can make the CRPS pain in my legs so bad that I can do very little walking on our OIC days, if any at all, and that makes John's caregiving job so much more difficult, because he has to not only be my legs for my household and work activities, but also he has to get me to and from the bathroom time and time again, or bring the bathroom to me. So lots of heavy lifting, and a supreme challenge for John and me. This OIC, very serious side effect.
Oh, wow.
Yeah.
Now, John, you've cared for Cynthia for more than 30 years. What advice can you provide to other caregivers who might be caring for a loved one in a similar situation?
Right. Great question. Well, I've been doing this for 30 plus years, so I've got a lot of advice to give caregivers, and I could go on and on, but we've got just a few minutes here. But a couple of things right off the top of my head is, this is a real challenging experience, taking care of somebody with chronic pain. It's really hard to see somebody that you love deeply in unrelenting, terrible pain. I mean, it's a rough road. It is, but and some days it's really bad, and then some days it's better. It's they can get out and they can go out and smell the roses and see the birds and feel, close to normal. Not normal, but close to normal. Also, it is chronic, and chronic equals, in my book, a marathon. It's a marathon. It's not a sprint. It's a marathon. So it's going to be something that's going to be around for a while. So as a caregiver, you need to take care of yourself on a day-to-day basis too, because you're only going to be, the way you feel is going to translate in how much care you can give somebody else that really depends on that care. So you need to take care of yourself. You know, you want to be a strong advocate for that person you're taking care of. You want to be a champion for that person. You want to be in their corner. There is strength in numbers, and so and there's strength in open dialogue and honest dialogue about the whole chronic pain experience, but specifically something like OIC where there is shame and maybe humiliation involved. It's about constipation. Who wants to talk about constipation? You know, oh my God, that's a lovely topic. But it is something that is a serious OIC is a serious condition that needs to be addressed honestly and openly, and you want to encourage them to speak honestly and openly with their doctors, with their healthcare providers about that. So when you go into that doctor's office with them, you want to make sure that you bring that up. They may not bring it up for whatever reason. They got a whole list of things they need to bring up.
Honestly.
You guys forget, right? So you want to be in there talking about this, you know, bringing up that very serious side effect, because it needs to be talked about.
Right, absolutely. And Cynthia, what advice do you have for those who might be experiencing OIC?
First, know that you're not alone. We at our nonprofit For Grace hear from people on a regular basis who are being treated with opioids and also dealing with the frustration and pain of OIC, though they're not aware that it might be caused by a pain therapy. Also, as John mentioned, please don't be embarrassed or ashamed of having OIC. This is a normal side effect to getting relief, and all of us with pain deserve relief. Also remember that OIC is not normal constipation because it's caused by the opioids, and as a result, at least for me, it's much more difficult to manage. John and I also always encourage a very open dialogue about all of your pain issues, but especially your OIC, because it can be embarrassing to talk about, especially at first. And most importantly, please make that appointment to go talk to your doctor about your symptoms and start that OIC conversation, because the good news is there is relief. With OIC, we no longer have to suffer in silence, and nor should we.
Exactly. Now, can both of you share where people suffering from OIC can go to find out more information, or even if they, just may feel that they have some symptoms and not quite sure?
Sure.
Where can people go to find out more information about OIC?
At our nonprofit organization For Grace, we provide information about OIC as well as information and resources for women suffering with chronic pain, and you can find us at www.forgrace.org. We hope to see you there.
Okay, awesome. Well, Cynthia and John, thank you so much for sharing this important information with us today. It is something that people need to be aware of, and like you said, not to be embarrassed, but talk to your doctor and open up that dialogue so that you can get the proper care that you give, and then for caregivers to take care of themselves as well so that they can provide the proper care. So thank you both for joining me today.
Thank you, McCabe. Good points. Well taken. Thank you.
It's our pleasure.
We appreciate it.
Thank you.
Thank you, and you two have a wonderful day and a great holiday as well.
Happy holidays to you.
Happy holiday to you.
Thank you.
Thank you.